I'm Katie Piper. 8 years ago, I survived an acid attack that changed my life forever. Since then, I've been on an ongoing medical journey to help me breathe, swallow, and see. Treatment and surgery are now part of my normal life.
This will be a little bit eye-watering.
So I'm all too aware of the miracles of modern medicine.
You know, the payoff's worth it, so.
Now I'm scouring the country because hiding away behind closed doors are some of Britain's most reluctant patients. They're living with a variety of shocking health problems when they should have seen a doctor or a dentist.
It's really hard to leave the house some days. I don't.
I've never gone to see anyone about it, just because I felt so embarrassed to take my top off in front of anyone.
I'm not accepting any more excuses. It's time to open the door on Britain's medical shut-ins. Introduce them to my world of medical miracles and reveal how medicine can transform their lives.
Gorgeous!
Wow.
In Essex, 56-year-old Sue has a secret.
I hide the fact that I've got no front teeth is that I came up with the idea of chewing gum. Just have to chew it and mould it back in. It takes me a couple of minutes. Bear with, bear with. I have to get the sides in. No, go out.
As a child, Sue had a series of dental mishaps.
I've been really unlucky with my teeth. From the age of 7, I walked into a scaffold pole and broke my front tooth. When I was 11, I fell off a wall, broke my other front tooth.
To make matters worse, her gums became infected. So by 15, she'd lost all her back teeth. Then when she was 30, a trip to the dentist changed her life forever.
I went to a dentist. They sprayed the back of my throat so that I wouldn't gag. I didn't realise this. Took some water, swallowed it, throat numb, chest numb. Gonna die, I can't breathe. Panicked, completely panicked, flew out the chair, flew home, and that was it. The last time I went to a dentist.
And that was 26 years ago. Since then, Sue's had time to perfect her chewing gum trick.
To get the perfect piece of chewing gum will take me about 2 to 3 days with chewing and staining, and I put the chewing gum in coffee so it's not sort of brilliant white against the discoloration of the rest of my teeth. I want to be able to smile and be comfortable when I go out, but I don't because I'm always conscious. What if the chewing gum comes out? What if I haven't got my spare chewing gum? So I just stay in there, don't go out.
Sue's not alone. An estimated 10% of us have a phobia of the dentist. But hiding away is not the answer, and I want to get this medical shut-in out.
Hiya, you must be Sue, yeah?
You came to
Yes,
lovely
I
to
am.
meet you.
It's really good to meet you.
Oh,
Thank
thanks
you
for
for
coming. Yeah.
Thanks for having me over.
This is where I first started doing with my chewing gum.
So you always use a mirror to put the chewing gum in?
It's in there at the moment.
Okay.
I take it out.
Hang on. Yeah.
That's
Tiny
just
root.
do it there.
Where it almost sort of snapped, really.
It's just snapped off. That one went up into my gum.
I'm amazed it stays in.
I think I got so used to it now, then I
Chew.
chew. Get it to near enough where I want it, and then I have to
Push
make
it.
sure it's...
You're quite an expert at
Oh
doing
yeah,
it.
I've done it for 3 years.
Yeah.
I couldn't tell that was chewing gum.
But you can't get away from the fact that this is not the right way to be living.
No.
This is a temporary solution for you to be able
Yeah.
to live and walk out
Walk
the door.
Yeah, yeah.
But it's not right.
No, it's not ideal at all, really. I think now's the time I've got to do something about this. It's getting ridiculous.
Sue's daughter Emma is desperate for her mum to get some help.
What about these DIY solutions of the chewing gum? What do you make of them?
Well,
I mean, it's noticeable, and she's like, "Can you see it? Is it noticeable?" And I don't know what to say because you can see it, but I don't want to stop her from going out or taking away that little confidence that she has got from it. She had so much confidence, kind of like the life and soul of the party, and she still has that personality. She's still inside like a party animal, but she doesn't want to go out. She doesn't want to be seen in public.
Sue and her daughter realise that her teeth are on the verge of making her a total recluse, and she needs to do something about it now. So after years of staying away from the dentist, Sue has let us make an appointment for her. Just for her to agree to see a dentist is a massive breakthrough. While Sue's been hiding away out of fear, some people avoid getting medical help because they don't even think they need treatment. In Lincolnshire, 62-year-old IT director Robin prides himself on not bothering his GP and is dedicated to keeping himself and friends fighting fit.
Right, OK, we're going down to the meadows. D's are off first, followed by C's.
I started running about 6 years ago, and in that time I've done 7 marathons now.
He's just become obsessed, and it's taken over his life.
So I was shocked to hear that for several years he's completely ignored a particular health problem.
I've had for a long time a varicose vein in my left leg. It sort of snakes around my knee, and it's quite soft and pappy. It doesn't hurt, you can massage it, push it, poke it, with no discomfort.
Oh. Come on, Freddie!
And Robin's grandson finds the vein just as terrifying as the rest of us.
The snake's coming, the snake's coming.
My children have both nicknamed his legs as having snake legs. Freddie often refers to it as the snake.
I've never seen a doctor about my varicose vein. It might stop running or my generally active lifestyle. I'd rather just live with it.
About 3 in 10 of us will have varicose veins at some stage, especially as we get older, although women are more likely to get them treated.
Varicose veins don't bother me from a health point of view because they're largely cosmetic.
The females in the family think otherwise.
Recently, they have got a lot bigger and really feel it can't be very healthy.
Dad doesn't seem concerned about them at all, but looking at how big they are and how quickly they seem to be growing, there must be a health implication to that.
Robin needs to listen to his family because varicose veins are not just cosmetic. They're a medical problem, and ignoring them when they get this big can lead to ulcers and blood clots. The veins in your leg are blood vessels that carry blood back from the foot towards the heart. One-way valves make sure the blood flows up, not back down. But if they get damaged or weak, blood flows the wrong way and gets stuck, making the veins swell up. This causes more pressure, especially when you stand up. In extreme cases, this can damage the skin, letting air and bacteria get into the tissue underneath, creating ulcers. Robin has finally caved in to pressure from his family and agreed to see Professor Whiteley, a consultant vascular surgeon.
Also the internal varicose vein that you can't see or meet at this point, and this is where you get your early skin damage. Let's just stand you up and see what gravity does to the veins. Yeah. As you can see, almost straight away your veins are filling up really, really full. And so basically if you have normal veins, they fill up slowly because the blood has to go through the arteries first, but yours are absolutely huge. This is actually only a representation of the veins on the inside that have gone wrong and coming to the surface.
Right.
An ultrasound reveals what's happening inside. And as his family suspected, the health outlook is not rosy.
What this actually shows is this is actually a lot worse on the inside, and the future, if you don't have anything done, you will end up getting skin damage, clots and ulcers.
I'm really very, very surprised and shocked at how bad the underlying problems with my veins were and how much some enormous veins that really need closing off.
Thankfully, reluctant patient Robin has at last realised he needs medical help and will soon be checking in for treatments. Sometimes, no matter how well we look after ourselves, illness can strike out of the blue. In Cornwall, 20-year-old Lily was a carefree student whose only worry was finishing her degree.
I was speaking to my best friend just at home. I just got back to uni for second year.
Yeah.
And all of a sudden, I found myself slurring my words, and I think I was just talking about the holidays and like happy memories. And then she was like, "Why can't you smile?" I was like, "I don't know."
Lily was diagnosed with Bell's palsy, which causes partial or full paralysis of the face.
Cheers, Lily. Cheers.
Probably in our teeth now. Don't smile.
I can't.
It's been really hard.
Yeah.
Because I'm only, 20 years old. I see all my friends going out, and I still go out with them, but it's not as easy. And I'd like to think that I do cope with it well, and that I can still do everything exactly the same as I used to. But it's always there in the back of my mind. When I meet new people, I can see them noticing it.
Bell's palsy affects 1 in 5,000 people. Doctors believe it's caused by a virus which finds its way into the facial nerve. The virus causes inflammation which can lead to paralysis of the face. Most people with Bell's palsy make a complete recovery, but it can take anywhere from a couple of weeks to many months. For some, the condition lasts their whole life. Lily tried steroid treatment but without success, so doctors suggested she waits to see if her condition goes away of its own accord. But over the past year, she has developed a worrying complication. Her eye.
Because it doesn't close completely, it gets really irritated throughout the day. And some days it'll be fine, and sometimes it'll be like ridiculously unbearable, to the point where I have to go to bed.
Because when you can't lubricate the surface and shut the eye, it like feels like shards of glass and stuff in your eye, doesn't it? It's
it's
really
horrible.
Quite unbearable.
I used to have really good eyes, and now when I close my left eye, I can barely see anything out of my right eye. It's very fuzzy.
Lily was referred to an eye specialist, but the appointment never came through. From my own experience, I know she has to do something.
I had a similar problem where, because my eyelids are scarred and they don't shut, so they were talking about putting like a weight inside the eyelid that can just make the eye, like manipulate it to shut. But yeah, I mean, an ophthalmologist would be a good thing for you to be regularly seeing.
Sight loss is more common than you might think. 360,000 Brits are blind or partially sighted. Half of these cases could be prevented if caught and treated early. But despite sight being the British public's most valued sense, a third of us don't have regular eye tests. I can't believe Lily's been living with this condition for a year. I really want her to get her eye looked at urgently. She's studying in Cardiff, so she's going to see an eye specialist at the University Hospital of Wales.
Hi, Lily.
Hi,
Dan
nice
Morris.
to meet you.
Come and have a seat. I'm one of the eye surgeons, all right. Nice to meet you.
You too.
So let's have a look at your eyes. If you could just very gently close your eye for me, and you can see, you can probably feel that your eye's open. The other problem, of course, is that we can see that when you're blinking, that your left eye blinks nicely, but your right eye just doesn't. So I'm just going to have a look at your eyes with this machine. This shows me how damaged the front of your eye is. Lily's Bell's palsy is significant. She has a very poorly closing eye, and therefore we need to do something about it. I can see there your eye's really dry. It's really important to be able to close your eye. If you can't close your eye will dry out and essentially become ulcerated and you'll go blind.
If I had known the urgency of the situation, I probably would have been more inclined to seek help, and then it could have been sorted out rather than a year down the line when my sight could have potentially been damaged.
Lily's now scheduled for some highly specialised surgery. A platinum weight will be inserted into her upper eyelid, so she'll be able to blink and close her eye again.
I'm pretty nervous about having surgery, but I feel like this is probably the first step towards actually getting better and recovering from this.
In Essex, Sue hadn't been to the dentist for 26 years, and her absence prompted some surprising DIY dentistry.
I came up with the idea of chewing gum. Bear with.
Today, with her chewing gum firmly in place and supported by daughter Emma, 56-year-old Sue's finally facing her fear of the dentist.
Feeling very nervous, feeling very sick. A headache.
I mean, I know nobody likes the dentist, but she's really scared. She'd rather cross the road than walk past the dentist. She doesn't like the smell. She doesn't like anything about it. You're shaking.
Breathe. Can't take any more tablets, much of a minute.
Oh yeah, all right. How are you doing?
Nervous, very nervous.
Well, it's amazing to see that you've got through the door. You know, I mean, I know what a big thing this is for you to be here.
Which is the worst part, just sitting there waiting. It's like I was going to the gallows.
Dentists Darwood and Tanner have decided a full set of fixed dentures will work best for Sue.
Come and take a seat. The chair's really squishy and comfy.
So today, their main aim is to keep her in the chair long enough to take a mould of her mouth, using a trick or two to distract their terrified patient.
Let's have some dark glasses. Okay?
No.
Keep taking deep breaths, Sue.
Open nice and wide.
First, they need to get rid of a different type of gum to the one they're used to.
Turn up a denture, there isn't a...
Then tackle the dentures.
If you felt my pulse, honestly, it must be about 120.
Just keep controlling those thoughts.
Really
Sue's so nervous, the dentist tries a distraction technique.
Now I'd like you to lift up your left leg. Really good.
Dental aerobics.
Bit more muscle. Didn't tell you to drop it yet. Lift your left leg. And then I'd like you to change legs. So brilliant. Come on, these are tummy exercises you're doing.
It's quite emotional knowing how much she hates them.
Yeah, how brave she's been. That's excellent. Nice and wide for me. Well done.
Just 30 minutes later, Sue's ordeal is over.
Is that okay?
Special patient, really. You surprised yourself, haven't you?
Fabulous.
All right.
A large part of dealing with anxiety can be seeing that your worst-case scenario, in this case the dentist chair, is bearable. Hopefully Sue can now face the rest of her treatment with a bit less trepidation. In Cardiff, 20-year-old Lily is now facing the reality of an eye which won't close, and is embarking on specialised surgery. Surgeons plan to insert a small weight into her upper eyelid to enable her to close her eye.
Hi, Lily.
Hiya.
How are you today?
I'm good, thank you. How are you?
Good. I'm just going to put a little mark on top of your head there.
It'll all be done under general anaesthetic, so she won't be aware of a thing. Two muscles enable us to blink. The orbicularis muscle around the eye contracts and closes it, and the levator muscle relaxes, so we can open it again. In Lily's case, the Bell's palsy has paralysed the orbicularis, so she can't blink or keep her eye closed.
So I'm just going to make the main incision now along the eyelid. So this is the platinum weight we're going to put into Lily's eyelid. It's fairly thin, which means it won't be too bulky within her eyelid, and quite flat. And you'll see it's curved to the shape of the lid.
Mr. Morris stitches the platinum plate to the most solid part of the eye, the cartilage, to keep it in place.
Okay, so that's the weight in place, the skin closed, and you can see that the eyelid doesn't really look much bulkier than it did, and it's nicely, neatly in place, and hopefully that'll make a big difference for Lily and the closure of her eye.
Finally, he tightens the skin on the bottom eyelid, which has drooped due to the Bell's palsy. I'll be catching up with Lily in a few weeks' time, and I hope the treatment is a success. There's no shame in asking for medical help, but we often don't, because we lack confidence or feel our problems are not serious enough to warrant medical attention. Running enthusiast Robin has suffered from varicose veins for years without getting medical advice.
I've never seen a doctor about my varicose vein. Varicose veins don't bother me from a health point of view because they're largely cosmetic.
But his are more striking than most.
The future, if you don't have anything done, is you will end up getting skin damage, clots and ulcers.
Doctors have been treating varicose veins for thousands of years. They're featured on the Acropolis in Greece, and in ancient Rome a treatment is recorded where they stripped out the veins using a hook. Hooks are still used today, but can leave scarring, and incredibly the vein can grow back. Robin is now one of 100,000 patients every year who have their veins treated, and he's having the latest surgery technique.
And why local anaesthetic is essential is we rely on the patient to say ow, because that tells us whether we're near the nerve. So some doctors still try and do this under a general anaesthetic, and it's much more risky for the patient.
A fibre optic laser will use heat to destroy the vein from the inside, which also ensures it can't grow back.
So this is the laser fibre here, and this is the thing that does the job. We're just going to put it up inside the tube, and then with the ultrasound we can see precisely to the millimetre where it's going, and we can see just there at the junction, so you can just see the laser sitting exactly where we wanted the junction, and when we start firing we'll come back a bit further from that.
Laser on.
Thank you. So just say stop if you feel anything at all, okay?
Yeah.
The fluid of the local anaesthetic also protects the tissue around the vein while it's destroyed by heat.
So that smell of burning meat?
Yeah, we can't smell that. That's little steam bubbles going up through your system.
Oh, right.
And you're just smelling it internally.
Oh, that's interesting.
Finally, the vein sealed off and removed in a procedure called a phlebectomy. This is a modern form of stripping where the dead vein is pulled out from tiny incisions. After 90 minutes, the job's done.
All finished then.
Thank you very much.
No problem at all.
The fact that I can now carry on with my little running addiction is a big relief.
Just 3 weeks later, when his daughter popped in to see how he was doing, Robin had already clocked up another 150 miles.
The great unveiling of them.
Great unveiling.
God. Don't they look better?
My gosh, they're
really
different.
amazing.
They weren't at all what I expected. They look like they were never there before. Are you pleased with them, Dad? Are you happy?
Really pleased.
I now feel I don't have to be disgusted looking around and seeing his horrible leg, and especially when he's going around with little on.
In all honesty, I should have seen a doctor a long time ago. I can't believe how easily and how quickly it's all got sorted out and how good my legs are now. Do you prefer the leg with the snake or without snake, Freddie?
Without the snake.
Do you?
My life's been totally transformed by medicine.
Thanks so much for your help. Okay.
So I'm horrified by the number of people living with shocking health problems, who suffer in silence rather than see a doctor or a dentist. For the last 3 years, Sue's been using chewing gum to hide the fact she has no front teeth.
To get the perfect piece of chewing gum will take me about 2 to 3 days with chewing and staining.
Now she's about to bid farewell to the gum once and for all, as she's come to have a full set of shiny new teeth fitted.
Good luck.
Today, what's exciting is that in just one day, we can go from no teeth or failing teeth to fixed teeth.
The time has come for her to say goodbye to the gum.
You know, why don't you take your denture out for the last time? Just pop it all in here. Don't worry about the... Just shove it in the box.
I have to get it. I know, but it's how I do it. I know it's
It's the last time, so it really doesn't make any difference. Go on, pop it in there.
I might need it again.
No, you won't.
Sharp scratch. We're not going to have you fast asleep, okay? You're going to be quite with it.
Can I talk?
Right? No, you mustn't talk.
In her first consultation, dentists took a mould of Sue's mouth. This has been used to help create a 3D image of her face and jaw. In all the time Sue's been steering clear of the dentist chair, she's missed out on how technology has moved on.
15 years ago, we'd never have thought about doing this all in one day. But with 3D imaging, with 3D printing, and the very special implants that we have at our disposal now, we can do this in a day.
From the mould, they've created bridges, a type of denture which are permanently fixed into position. In Sue's case, each bridge will be fixed to 4 screws implanted into the jawbone. A matching metal recess in the bridge attaches to each implant to hold it in place. In her upper jaw, where her teeth have been missing for longer, the jawbones receded, so 2 of the implants will be screwed into her cheekbone instead. Once the new teeth are fitted, she'll have to keep them really clean to avoid infections.
Open wide. Wide as you can, Sue.
Before they can fit the new teeth, they need to remove the 7 teeth she has left.
It all gets a bit easier, actually. So if you imagine that I'm putting a raw plug into the wall, then the first thing I'd do would be to drill a hole, and that's what I'm doing now. If I could have a screwdriver, please. Open very wide for me. You can then take hold of the bridge, push it into place.
After 4 hours, Sue has her first full set of adult teeth. But how will she adapt to such a dramatic change? Medical science has helped me to cope with my injuries, which I've had to live with for 8 years. So I'm staggered by how many people I meet who have a medical problem but don't do anything about it. Josh looks like an ordinary, happy, healthy 18-year-old, but he's actually been hiding a problem almost all his life.
I was a year and a half old and I accidentally poured boiling hot tea on myself. I was airlifted to hospital, and despite best efforts I went into toxic shock and was very close to death at one point.
A toddler's skin is thinner than an adult's, and a cup of tea at 70 degrees centigrade would scald a child at the age Josh was in 1 second.
The accident has left me with 3rd-degree burn scars over my chest and shoulders and neck, which can cause tightness as well as being visually off-putting.
In the UK, 77% of burn injuries happen in the home, and each year 2,000 children under 5 go to hospital with them. Their treatment and the treatment I continue to benefit from were all developed in the Second World War. Sir Archibald McIndoe and his team at East Grinstead Hospital pioneered new plastic surgery techniques, including skin grafts to rebuild noses and eyelids.
There are the trained eyes and fingers of the surgeons, remaking an eyelid, a nose, a pair of ears, rebuilding a shattered face.
They also improved survival rates by immersing burn survivors in saline, which promoted healing, laying the foundation for the treatment that saved Josh's life 17 years ago.
Hi Josh, how are
I'm
you?
here to show Josh that treatment has moved on once again, and more can now be done to help him.
You were so young, I guess you don't even remember sustaining the injury.
No, I remember absolutely nothing about it.
Josh's scars are known as contracture scars. When skin is burnt, it tightens and contracts, which as you grow restricts movement. I was burnt when I was 24. It's hard enough as an adult, but some believe when a child suffers these scars, the psychological impacts can be even more damaging.
It was the moment I sort of hit almost 8 years old. People would sort of call me names, whether I was changing in the change room for PE or something, and people would just turn around and say, "Oh, what's wrong with you?" and things like that.
It's quite a violation when someone points out something on your physical being.
Yeah, very much so. And sort of, I don't remember ever seeing a doctor for it. I've never gone to see anyone about it. Even when I go for normal checkups, I just never mention it.
Right.
I always sort of have hidden away from all of that, just because I felt so embarrassed to take my top off in front of anyone.
I mean, I know for me, on my own journey to recovery, I would say it was 50% physical treatment and 50% psychological treatment. I suppose I learnt that I couldn't expect people to accept me if I didn't. And I think that was as important as any skin grafting or lasering or any treatment I could have on the actual burns.
Yeah.
You can't cure long-term scarring, but you can improve the flexibility and appearance. Over 1 million people in the UK have a significant disfigurement to their face or body. They don't all cause physical problems, but I know myself that looking different undoubtedly affects you psychologically. In Wales, 35-year-old dad of two Dave has spent his entire life living with a very visible birthmark. This particular birthmark is known as a venous malformation, and it's caused by abnormalities in the walls of blood vessels, which prevent them from holding their shape. They fill with blood, making the veins bulge and look very dark red. In medieval Britain, we thought people with birthmarks were witches. Later, marks on babies became known as strawberry marks, because we believed they were caused by what mothers ate or craved in pregnancy. Stalk marks are the most common, affecting 40% of newborns, named after the bird that's supposed to have delivered them. These eventually disappear, while venous malformations like Dave's continue to grow and darken in colour. Growing up with a birthmark has really knocked his confidence, along with trying numerous treatments with little or no success.
I had injections, I had bits cut out, different things. I had laser surgery, I had cryotherapy.
Some of those treatments were very, very painful for Dave indeed, and he didn't seem to get a lot of result.
When Dave married Rebecca, the prospect of raising a family presented a new problem.
He was so scared that he would pass this on to his children. Even though he was told many times, this isn't hereditary, your children won't get it, he couldn't relax.
It was a very big relief that they were perfect. Wouldn't wish for anything better. They're great.
While the children were birthmark-free, Dave's malformation kept growing and there seemed to be no medical solution in sight. But then last year, all that changed when he came across Mr. Muir and his pioneering treatment.
We prefer to treat malformations in a non-surgical way. It's a scarless treatment, and we utilise a drug that's called bleomycin. Bleomycin is a cancer drug. It's one of the older drugs and not used that often anymore.
it. You get yourself comfy on there.
Bleomycin is injected directly into the veins. It contains a chemical that irritates the abnormal blood vessels, causing the veins to shrink, reducing swelling and colour. Today, Dave's having his 12th treatment, and already it's had dramatic results.
To be able to have a treatment that doesn't hurt us anywhere near as much as the other treatments I've had, and for it to have positive results is brilliant.
Mr. Muir's pioneering treatment has a 93% success rate, and it's now being introduced into other hospitals across the UK.
Meeting Mr. Muir and having the treatment is one of the best things in my life at the moment. To do what he's doing to change somebody's life like he is, it's amazing.
Hi.
Hello.
How are you doing?
Good, thanks.
Okay, feeling back to normal?
Yeah.
He used to be really engorged around his mouth and lips and everywhere. It was really engorged with blood and it was a mess. Now it's gone. He's, how do you say it, normal.
Dave will need several more doses of bleomycin to get the best long-term results, but already his future's looking much brighter.
Oh, it makes you feel brilliant knowing that something's working is amazing. It gives you some hope, really.
Sue previously used chewing gum to cover her missing front teeth. But today, after 6 months of dental treatment, she no longer needs to hide away. Instead, she's coming out for a drink with me and some of her family.
Hello. Good to see you all. Good to see you. So, Emma, we finally made it to the end.
We have.
Did you think she'd get there?
No, I really didn't. I didn't think she'd come this far.
And you can't show off your new teeth without a bit of makeup.
Are you okay, yeah?
I'm so nervous.
Yeah.
I can't wait.
Oh my God!
Why took this so long?
I've never seen Mum with a full set of teeth. It's overwhelming. She looks so beautiful. Now, it's like a different person.
Well done. I'm so proud. Oh, thank you.
I couldn't be prouder, and I keep bursting into tears. She's my old mum and a new mum, and she looks fantastic.
Do I look different?
Does Nana look pretty?
I look in the mirror and I know it's me because I'm speaking, but it doesn't look like me. I look completely different.
Can we now officially ban chewing gum from your life?
Oh, God, yes, definitely. It's got to go.
It looks absolutely incredible. The teeth look amazing. She's got a different kind of zest for life about her. You know, her smile seems really genuine, not just because she's proud to show off her teeth, but she obviously feels good about the way she looks now.
We can't believe I've left it this long and didn't do it earlier.
Cheers! Yay, well done. Congratulations.
I'm meeting people who've spent years ignoring their medical problems and getting them to take control of their lives and seek treatment. 18-year-old Josh was burnt as a toddler and has borne the scars ever since. You can't cure long-term scarring, but you can improve the flexibility and appearance. So I've got Josh to meet one of my doctors, Dr. Patel, to see if the treatments I've had can benefit him.
Good morning. How are you doing? Are you okay? Yeah, you're feeling all right? Oh, I'm so glad you're here. It's great to see you again.
How are you, Katie?
I'm
nice
good,
to see
thank you. Yeah.
First time you're going to be on this side of the
right.
couch.
Yes, yeah, that is a first for me.
Yes,
okay.
Dr. Patel is using 2 types of laser to treat Josh. First, a carbon dioxide laser breaks down the scar tissue and reduces the tightness of the skin. Then a pulse dye laser eliminates damaged cells, reducing the red pigment.
I was very nervous. I was sort of doing that whole routine of trying to think of everything that could go wrong.
So you're in safe hands, you don't have that
Yeah, exactly.
added worry, you know.
Be brave for me now, grit your teeth. This is going to be a little burny, but I'll get it over and done with nice and quickly, okay?
Just take really deep breaths.
How did that feel?
In and out.
It's weird,
like
right?
being stung by nettles.
Yep, that's the one.
That's it. Keep breathing, don't forget to breathe. This high-tech procedure worked for me, and I really hope it can help Josh too. You're really doing well.
That's the chest scar done. Now I'm going to do the shoulder. Okay. And we are done. Well done.
I feel like really excited, even though it's not me.
I know. The thing about these treatments is it's a waiting game. But
Yeah.
I've never treated anyone who hasn't had some visible improvement after even the very first session.
Yeah. Josh will need around 10 more sessions over the next year to get the best results. But he's made a great start.
Ready? I was born ready.
Just a few months later, Josh has already noticed a big change. Not only in the way the scars look, but how they feel and how much more flexible he is.
Treatment itself has been amazing so far. It's only been sort of a couple of treatments, but the results so far have been really, really encouraging and really good.
His brother Dan has also seen a change in him.
2, 3.
Josh is feeling so much better. He feels really, really confident.
It's just the feel of it. It's softer, not as tight.
Yeah.
You know, I feel like I've got more mobility in my chest.
Go on then, let's have a look.
The treatment has really boosted Josh's confidence.
I could really take off my shirt in front of anyone. Maybe not go streaking out in public, but it's so much smoother than it was.
Oh no, it's really good though. Do you feel happy?
Yeah, well, I've got on top in front of you, and it's really cold in here, so.
I mean, it's changed his life. It really is amazing.
If I could say anything to someone who's got this, I could only ask you just to try it and just to try and do it. Go see someone, talk to someone, because it'll be worth it.
"21-year-old Lily suffers from Bell's palsy and was in desperate need of eye surgery. Today, Lily's catching up with family, and I'm joining them.
Come on.
It's the first time they've seen Lily since her operation a week ago.
Oh, darling, I love you so much.
It makes me really happy. Well, of course it's going to make me really happy because it makes her happy.
I think Lily looks so much more confident now. I've seen her in just the most darkest of times, and I think she's come out of that and is just exuding happiness and confidence.
That looks so much better. Yeah, it's incredible.
It's quite a drastic difference.
Really good.
I'm the proudest dad in the world. Lily is such a beautiful girl, and it's such an awful thing to happen to her. But now, I think things are only going to get better.
And how's it close?
Let's
see. That's brilliant. Look.
Oh, fantastic! You'll be doing that. She'll be doing that all the time now.
Yeah, that's really so significant.
I really think I should have gone and had it done earlier because it would have cut out that whole year of being in pain and discomfort.
So here's to Lily.
Yay!